Hello, I'm Jonathan Nelson with the Texas Academy of Family Physicians, and this is your Capitol Report. Last year, a state agency released a report showing that Texas medical schools would soon be producing more graduates than the number of first-year residency positions available to them. Because of this gap, the report states that by 2016, at least 180 medical school graduates will have to leave the state for residency training. TAFP President Troy Fessinger says that lawmakers in the 83rd Texas Legislature are keenly aware that losing those newly trained physicians is bad for Texas.
The state's already invested in their medical education. They want to get trained. If they can't find the opportunity here, they will go somewhere else, to another state. And what we also know is they will stay. They are not likely to come back.
Last session, lawmakers cut state funding for graduate medical education by 44%. And they cut direct support for family medicine residency programs by 74%. TAFP President-elect Claire Hawkins says the cuts to family medicine programs have been particularly damaging.
What we've found since these funds were reduced is that most residency programs had to reduce some amount of patient care activities, either through reducing faculty, reducing residents, or reducing hours that they can see patients. And so as a result, not only have you decreased the supply of doctors who can care for primary care patients, but you've decreased the number of encounters that people have with doctors.
Restoration of funding for family medicine residency training is TAFP's top priority in the 83rd Texas Legislature, followed closely by supporting initiatives to increase the number of residency training positions throughout the state. You can download a series of issue briefs describing the need to invest in graduate medical education on the advocacy page of the TAFP website, tafp.org. The Physician Education Loan Repayment Program is designed to provide up to $160,000 in loan repayment for doctors who commit to practice in underserved Texas communities for 4 years. Since the current version of the program went into effect in 2010, about 150 physicians were enrolled and are now practicing in underserved communities. That number would be higher, but the state suspended the program after lawmakers cut its funding by 76% last session. Dr. Rodney Young, chair of the Department of Family and Community Medicine at Texas Tech University Health Sciences Center, recently told a panel of House budget writers why the legislature should restore those funds.
It's hard to overemphasize the importance of that because of all the things we've talked about today, all the pipelines for education, how we get students into medical school, how we fund residency programs. The Physician Education Loan Repayment Program is the only vehicle that takes practice-ready physicians and gives them an incentive to go to the places where we need them.
Dr. Young also called on lawmakers to restore funding for the statewide primary care preceptorship program, which puts medical students in primary care clinics so they can experience the scope and breadth of a career in primary care. The legislature eliminated funding for the program last session.
We could line doctors up who've had favorable experiences here, but we probably don't need a line because in the interest of full disclosure, I'll tell you, I'm one of those students. I spent a month in Cameron, Texas between my first and second year of school, and it changed my life. It changed my career path and cemented my interest in family medicine. So I'm a living testimony of the effectiveness of the program, and there's hundreds of other people like me. It's a small dollar program in the great scheme of things, but it does a lot to influence the perceptions at an early stage in their medical education of primary care as a potential discipline. So it's very effective in helping to shift the mindset and make that a feasible possibility for the students to consider.
Just about everybody at the state capitol knows about family medicine. That's partly because when they get sick during the legislative session, there's always a TAFP member in the Capitol First Aid Station. For more on the Physician of the Day program, here's TAFP's Samantha White.
Each legislative session, TAFP members serve as Physician of the Day. They spend a day in the Capitol Health Clinic treating legislators, their staffs, and anyone else on Capitol grounds. The work these doctors do is crucial. They see between 25 and 40 patients a day, and the clinic typically handles one emergency each month during the session. Today's physician is Dr. Roseanne Pope of Houston, and this is her 7th time to serve.
I just like to see new and different things. I just like to see, how the legislature works and just see the different different people. Like when I went into the cafeteria this morning, I was just fascinated by all the different groups of people sitting there. Wonder what they're here for. Wonder what their agenda is. And it's just fascinating to see the different parties at work, things that I don't usually get to see every day. Oh, I think you should consider doing this because if you're a family practice doctor, because it gives you a chance to give back. It gives you a chance to meet different people, gives you a chance to see your legislators at work. And it's just a way to give back to the community that I think is very interesting and fascinating.
The Physician of the Day program presents an excellent opportunity for state legislators to see family doctors at work. There are still open slots through May. If you're interested, go to the advocacy page of TAFP.org and click Physician of the Day. For TAFP News, I'm Samantha White.
For more in-depth coverage of these and other issues important to the family physicians of Texas, check out the news section on TAFP's website, tafp.org. And be sure to watch your email inbox for our next edition of TAFP News Now. Thank you for watching TAFP's Capitol Report. I'm Jonathan Nelson. We'll see you next time.